The Charlotte-Mecklenburg Asthma Education Program is designed to create safe and healthy learning environments for children with asthma. Looking at our data, we knew we had a number of children with asthma, but we didn't have a formal way to address them. We found that we had, at the time, over 4,000 students, and they had a higher absence rate than students in the general population. If they're not in school, they're not learning, and that was one of our primary goals. Well, we realized in order to make a program successful, we needed administrative buy-in. So when we visited principals, we presented them with their individual school data, and this was a key way for them to get a clear picture of how asthma was affecting their students in school. We developed coordinated school health teams with an asthma focus in all our pilot schools. Understanding the nature of the disease was important in recognizing the subtle symptoms so that they could get help for the children when needed. We had one student who we became aware of in elementary school was struggling with his asthma. We worked with the parent. The school nurses developed a plan for him. He had his medication, and everything seemed to be going well. And then the following year, when he started middle school, there were significant issues that popped up. Asthma is not just a physical disease, but it often has an emotional component as well. So entering into middle school for this child, he was afraid to admit that he was having any difficulties. The nurse at the school was very astute, and she worked with the student to get his medical condition and his action plan in place. It didn't solve the problem for his asthma attacks, however, which he continued to have. We had to look into the situation a little deeper to find out what was causing the attacks. The awareness of asthma and the collaborations that were built through the asthma education program led to the development of key policies that would guide the district in creating safe and healthy schools. The principal was very proactive and involved the school administration, the staff, the nurse, the teachers, and the custodians at looking into the environmental components and triggers for asthma. What we look at is the building envelope of a school, the HVAC systems, the indoor air quality, the no idling policies, and the integrated pest management. And what they discovered was the frequent use of aerosol sprays in the school by the custodians, some of the teachers, and even the students was a trigger for his asthma. They developed a policy for that particular school not to use aerosol sprays. For the rest of the year, that youngster did not have another asthma attack in school. This is a significant benefit for health outcomes for these students who were in the schools but not previously identified or serviced to the degree that we can do now with our multiple partnerships and programs. My name is Nancy Langenfeld, and I believe that innovation can be a springboard for healthy schools and communities.